So, good afternoon. I will be your student nurse for today. My name is Rihanna Pineda, and my objective for today is to provide a procedure um, cold compress to the patient who has injuries or wound. And now I will be identifying the patient. So, sir, could you please state your name, your birthday, and your age?
Daryl P. Antonio, February 22, 2007, and currently 19 years old po.
Okay, so let me check your evidence, sir. Okay, thank you. So, I can also verify it to previous hospital medical history of the patient. And then next is I'll be verifying the order for the doctor's order for to prevent errors. And next is I'll be going to review the patient medical history. And then next is I'll be assessing the site of injury of the patient. So now let's just pretend that the patient has a injury in the leg or lower leg. So I will be inspecting it, so I'll just going to expose it. Okay, so now I'll be inspecting the color, odor, and if there's any wound that is present. So right now the patient has a mild swelling. So next is I'll be going to assess the family of the patient, of their knowledge about the understanding of the procedure and related to safety factors. And then now I'll be going to assess the vital signs of the patient. So I'm going to assess the temperature of the patient. And then let's pretend that it's already done, the vital sign. That will be the baseline to compare the vital signs to later reassessment for the patient. And then next is I'll be going to answer the questions of the family members. And then now let's prepare all the materials or equipments. So I have here the towel, the waterproof underpad, and the other needed for the procedure. So now I'll be placing the waterproof underpad to the patient to prevent the spill to the bed liner. Okay, thank you. And then now I'll be going to first, I'll be acknowledging that I have to wear gloves before I hand hygiene my hand to prevent microorganism. And then let's wear our gloves. So we have to wear gloves before we put the waterproof underpad. And then next I'll be going to explain the procedure to the patient. and with the and I will ask for the approval or consent for the patient. So sir, so today po is I will be giving you a cold compress po. Bibigyan po natin ng malamig po na kasama ng towel para ma-relieve po yung pakiramdam nyo sa area or site po ng injury nyo po. So is that okay with you po? Okay. So then is I will put the towel and soak it to the cold temperature of water. And we can also use other types of cold compression, like the bag that you can put ice. So today I'm just going to use a towel, and then this one. Then I'm going to put it to the site or affected site of the patient, just gently, and then ask the patient if do you feel any discomfort, sir? So okay, so we have to check it in regular intervals and check the skin condition if there's any unexpected outcomes, like the patient is having pain in the site, so like that, and then I'm going to reapply it again, and then we can stop immediately if the patient already causing it discomfort or having a fever, such as like that. And then after that is I'm going to discard all this these gloves and all the materials after we put it okay sir. And then after we discard all the materials into the proper yellow trash bin, I'm going to hand wash or hand hygiene, and then help the patient for proper position. Yes, sir. And now go back into your position, feel comfortable. And then after like that is I'm going to reassess again the vital signs of the patient and the site or the area after we cold compress it, to evaluate if there's any improvement in the cold therapy that we do to the procedure. And then I will document to the procedure that we do, and then refer it to the physicians if there's any unexpected outcomes that will occur. So that's it. Thanks.